Hi guys, welcome to our channel. Today we are going to look upon what is Polycystic Ovary Syndrome, that is PCOS, and how it affects your body and many more. This topic will be divided in several videos and this one is part 1. So let's get straight to the point. Polycystic Ovary Syndrome is a condition that affects a woman's hormone levels. Women with PCOS produce higher than normal amounts of male hormones. This hormone imbalance causes their body to skip menstrual periods and make it harder for them to get pregnant. PCOS is a problem with hormone that affects women during their childbearing years, that is ages between 15 to 44. Around 26.7% of women in this age group have PCOS. Many women have PCOS but don't know it. In one study, up to 70% of women with PCOS hadn't been even diagnosed. PCOS also causes hair growth on face and body and baldness, and it can contribute to long-term health problems like diabetes and heart diseases. So moving further about what caused the PCOS, basically the doctors don't know exactly what caused the PCOS. They believe that high level of male hormones prevent the ovaries from producing hormones and making eggs normally. Factors like genes, insulin resistance, and inflammation have all been linked to excess androgen production. Further explaining it deep, genes. Studies shows that PCOS runs in families. It's likely that many genes, not just the one, contribute to the condition. Second, insulin resistance. Up to 70% of women with PCOS have insulin resistance, meaning that their cells can't use insulin properly. Insulin is a hormone the pancreas produces to help the body to use sugar from foods for energy. When cells can't use insulin properly, the body's demand for insulin increases. The pancreas makes more insulin to compensate. Extra insulin also triggers the ovaries to produce more male hormones. Obesity is a major cause of insulin resistance. Both obesity and insulin resistance can increase your risk for type 2 diabetes. Third, inflammation. Women with PCOS often have increased level of inflammation in their body. Being overweight can also contribute to inflammation. Studies have linked excess inflammation to higher androgen levels. Further moving up to common symptoms of PCOS, some women start seeing symptoms around the time of their first period. Others only discover they have PCOS after they have gained a lot of weight or they had trouble getting pregnant. The most common PCOS symptoms are irregular period. A lack of ovulation prevents the uterine lining from shedding every month. Some women with PCOS get fewer than 8 periods a year or none at all. Heavy bleeding. The uterine lining builds up for a longer period of time, so the periods you do get can be heavier than normal. Hair growth. More than 70% of women with this condition grow hairs on their face and body, including on their back, belly and chest. Acne. Male hormones can make the skin oilier than usual and cause breakouts on areas like the face, chest and the upper back. Weight gain. Up to 80% of women with PCOS are overweight or have obesity. Male pattern baldness. Hair on scalp gets thinner and may fall out. Darkening of the skin. Dark patches of the skin can form in body creases like those on the neck, in the groin and under the breasts. Headaches. Hormone changes can trigger headaches in some women. Further looking up to how PCOS affects your body, having higher than normal androgen levels can affect your fertility and other aspects of your health, like infertility. To get pregnant, you have to ovulate. Women who don't ovulate regularly don't release as many eggs to be fertilized. PCOS is one of the leading causes of infertility in women. Metabolic syndrome. Up to 80% of women with PCOS are overweight or have obesity. Both obesity and PCOS increase your risk for high blood sugar, high blood pressure, low HDL, that is good cholesterol, low LDL, that is bad cholesterol. Together, these factors are called metabolic syndrome and they can increase your risk for heart disease, diabetes and stroke. Sleep apnea. This condition causes repeated pauses in breathing during the night, which interrupt your sleep. Sleep apnea is more common in women who are overweight, especially if they also have PCOS. The risk for sleep apnea is 5 to 10 times higher in women who have both obesity and PCOS than in those without PCOS. Endometrial cancer. During ovulation, the uterine lining sheds. If you don't ovulate every month, the lining can build up. A thickened uterine lining can increase your risk for endometrial cancer. Depression. Both hormone changes and symptoms like unwanted hair growth can negatively affect your emotions. Many with PCOS eventually experience depression and anxiety. This was all for today's topic. In the next video, we will see the diagnosis, pregnancy and PCOS and how PCOS is treated. So if you like the information, please like the video and make sure you subscribe our channel. Thank you.